So let me make you understand how to prepare for the exam once. Then you can ask me questions. In this session, we will be discussing how to prepare. So our major concern is how to prepare. So I'll tell you how you should prepare for the exam because I've been seeing this pattern of exams since 7 years. So a lot of messages are being put into my, like, I'm getting them from multiple students through WhatsApp, through Telegram. So try to understand that this is not a like a pre-PG set exam or NEET PG exam where you read some important questions and get through the exam. First of all, never ask anyone important topics for the exam. Whoever asked me that question, so I just cannot answer that question because see, there is no fixed syllabus for you. There is no fixed syllabus for you. There is no fixed Q bank for ENT. First of all, try to understand that. And second thing, I see lot of students. Second question they ask me is, "Sir, I am going through some residency app. They are giving some MCQs there. I'm having these doubts out of that." So majority of the times, those who are teaching in residency apps, they might have not done MCH. So don't go through those MCQs unnecessarily and don't go into the trap. My request, sincere request for you is, so go to a teacher who has already like done MCH. Not only me, anyone who has done, because they has gone through the tussle, whatever tussle that you are facing now. He has gone through that phase and he knows what questions are given in the exam. You can ask me, sir, why can't we go with residency app and do the same thing like that? So residency app, people will be thinking in terms of like finishing the theory practical, not for MCH. And second thing I want you to note down, see, preparation for residency is different and NEET SS in ESS is different. So you cannot club together. You cannot club together. You want to read, you can read together, but for the preparation of NEET SS, you need to jot down some points out of every chapter. You cannot read it like a story. You just have to note down important points of every chapter of Scott. For us, yes, Scott Brown is a Bible, but it doesn't mean that every paper will be from Scott Brown. But three-fourth or more than 80% of the portion would be from Scott Brown. So rest 20%. That's why I will tell always my students to read Bailey Otolaryngology Review Book because that will cover one more textbook. And unfortunately, Cummings review has not been updated. Whatever there is an outdated that will not help you. Jatin Shah book will not help you for even NEET SS or INESS. So I will suggest you Scott Brown textbook for theory. I mean to say for the MCQ purpose, you have to cover full textbook. For MCQs practice, you should do Bailey Otolaryngology Review at least. These two books are a must. So there is a book by ENT Bullet Points. There is a book by ENT Board Review. There is a book by Ent Thazar. So which are multiple books which will help you for the exam, yes. But the concepts which are there in that books are little old. And Jatin Shah is not updated since 2012. I request you, see, I wrote a book. My book is containing 8th edition AJCC staging. Now it is 9th edition. See, I myself feel my book of review of head and neck surgery is a outdated thing. But MCQs there are from previous in ESS and NEET SS pertaining to head and neck. So that's why I have written that book so that would help you people. But this Jatin Shah book is 2012 book. So people are reading that now. Yes, I agree it's a standard book, reading that now. But whenever you're reading, read with caution. Read with caution because that is meant for European board exam in 2012, 2012 to 14, not now. It's almost 12 years or 14 years ahead, which we have gone through. There are a lot of changes. And one more issue I'm going to tell. Sir, Scott Brown versus Cummings. Someone asked me, Ruchir, only Scott Brown. Cummings is for your understanding purpose, but majority of the examiners give only MCQs from Scott Brown. As I told you, 80% would be from Scott Brown. Sir, should I read line to line? Yes, you should read ideally, but majority of the people are working. And due to that, majority of the times in these classes, we would like to take majority of the Scott Brown based MCQ classes or Scott Brown based revision classes. That is a point, right? So I will take you through how to prepare. Just see, then we'll discuss what we should do. This is only 4 slide thing. Rest I will cover all your doubts in this session. So in ESS preparation strategy, in next 4 to 6 weeks, you'll have full course uploaded in the app. Already we have finished first recordings in Search Test app. We are going to upload since 17th. We'll continuously upload. So you'll have all the course available in the app for the coming exam in April 24th. So you'll have the everything content in the app by April 1st week. And we are providing 5 GTs, which includes 400 MCQs, and there are 1000 head and neck MCQs. And you have general surgery MCQs in the package. So it covers everything. So why I'm telling this? If you are reading for NEET SS, I don't want you to spare major time on general surgery. Major time on general surgery. For NESS, general surgery is a must. Last year, they gave 34 questions. Out of 80 questions, they gave 34 questions on general surgery. They give some picture of surgery and ask what is the surgery's name. They give some scenario of a breast cancer and ask you what is the treatment of choice. They give some prostate cancer, ask you what is the treatment. Or they have given some treatment, what is the next step in treatment. Or what is the investigation of choice. These questions are from like NEET PG level general surgery questions. But for us, they are new. For NESS exam, you should definitely give. Sir, why do they give that? Because the eligibility is for general surgery, ENT, along with general surgery, ENT. Yes, Arbaz was telling that breast cancer, colon cancer, testicular tumors, all are there. To solve this, there are 2 things which I want you to follow. Either you have to go read head and neck topics. Along with that, you have to read Bailey and Love general surgery book. But that is highly impossible for you. So I always say to you, believe in only one app. Believe in only one app. So I saw few students going for some other app for general surgery and thinking what to be done. That's why to solve those, I am suggesting you one thing. Due to time lapse and everything, you do always retrograde reading. How will you do retrograde reading? Since we have provided general surgery questions here, take those general surgery questions, and you should read retrograde way. You should read retrograde way. What is this retrograde way, sir? See the question, see the options, go to the topic, read everything regarding that topic. So, for example, someone wrote testicular tumor. So, see the MCQ there, go back to the topic, read about testicular tumors, come back and answer that question. Definitely 95% or 99% of the times you will be correct. So, with this, your confidence will boost. You cannot sit and read whole general surgery. That's highly impossible. Being a ENT resident, you would have forgotten what is there in general surgery. It's very impossible. Majority of the students ask the same doubt. Don't go and read. Answer MCQs for general surgery. Then what to do about head and neck? Head and neck, you leave on to me. Responsibility is mine to cover everything. In this rapid revision course, I am covering everything. Though it is written for 8 hours, we are exceeding it to 15 hours. But the only thing, you should cover that before exam. That's the only thing. This is regarding NESS. You will get definitely questions regarding breast cancer, testicular cancer, as someone told, colon cancer, lung cancer, shock, blood transfusion, everything. Out of 80 questions, 34 is very huge. And whatever they gave head and neck questions in the exam, they're all basic questions like nasopharyngeal carcinoma associated with which virus? EBV, HPV. This is a basic question. For that, you need not purchase 100 apps and read for NESS head and neck. NESS head and neck is a proper exam. Yes, sometimes they give trials and everything, but majority of the questions are answered by everyone. The rank deciding for NESS is general surgery. The general surgery, it's a difficult for an ENT resident to go on. So you have to do a retrograde reading. First point is retrograde reading. Retrograde reading is nothing but go to that. Yes, true. November session, they are giving more of general surgery, comparatively less in April session. Agreed. That pattern has also I have seen. Agreed with that because 34 is the highest. 34, 35 is the highest till now. Because out of 80, you are left with 50 questions. In that 50, majority would be head neck basic questions. So in April exam, they are not reaching 34, 35, but they are cutting down to 20, 22, like that. So that pattern has been seen. Correct, Manika? So I would request you to attend INESS Rapid Revision course and finish off this juggle. And for MCQs of surgery, you should read retrograde way. We have updated the MCQs in the general surgery folder. That's about INESS. That's about INESS. Yes, everything will be there, doctor. You'll have swallowing scores. You'll have like penetration aspiration scales. So definitely they will ask classifications. Sometimes they will ask you laryngeal stenosis classification. Even though it's a head neck paper, they will ask you Bogartsonian classification, which is laryngeal stenosis, cleft classification, Benjamin Ignis classification. So the fancy things they never leave. So EDSS is a combination of fancy things, recent trials, and the things which you go wrong. And the things which you go wrong. It's not about easy paper or something. They want you to get confused and mark wrong answer. So that's why they give classifications with something like intra-adenoid adhesion, which type of Benjamin Ignis classification or which type of Bogartsonian classification, like that, intra-adenoid adhesion, Bogartsonian type 1. So that you should understand that what he wants, that is more important. That is point number 1. Point number 2, for general surgery, I told you. Sometimes they give 2 to 3 statistics questions. 2 to 3 statistics questions. So difficult for us again. Yes, latest trials, definitely you will get immunotherapy. You can see the interview of Abhishek AP, who is my student, last year student. In YouTube, it is available. He has read all the trials. Immunotherapy, definitely every exam, one question will come. If they don't give oral cancer or head neck cancer immunotherapy, they will ask thyroid cancer targeted therapy. They will ask salivary gland cancer targeted therapy. Every question is same. Chemotherapy, earlier during my times, there is no immunotherapy major question. They used to ask chemotherapy drugs. What is the side effect of so and so drug? What is the rate limiting toxicity for this drug? What is this chemo? To 2019, 2020, that time papers, my students used to ask for a lot of chemotherapy classes because that time that is a fancy thing. Yes, ATA guidelines. This in ESS November session only ATA guidelines they have asked, and immunotherapy they are asked. NEET SS, I am going to come in the next slide. Don't worry, doctor. First of all, we are dealing with INESS. Yes, they will ask 2 questions out of the trials. They will not ask you what is the result of the trial majority of the time. They will ask you, this drug is pertaining to which trial or this trial is pertaining to which drug. That means, for example, exam trial, Zita trial, Vendatorib, exam trial, cabozantinib in thyroid cancers. Like that, in the same way, they can ask like checkmate 140. So Nivo post-op, you know that it's nivolumab. So that type of questions will come in the exam. And they sometimes they want to bring, they will bring in this trial, overall survival is this benefited, not benefited, progression with survival benefited, patient has lived longer. This type of option they can give. So for these trials, yes, you should attend the class because definitely you will not know what is new, what is not new. And for your best now for the students, earlier you don't have Stellenmaran. Now Stellenmaran has come recently. That can help you in these latest aspects. But again, any SS exam, they will take a recent journals and give you all the trials. So don't worry. We are dealing with all these in the class. Don't worry. If you are attempting sincerely in ESS, please do it. Surgery videos, no. I told you again, see, Pramod, don't try to waste the time in surgery videos. If you waste the time in surgery videos, you will not get anything. I am discussing again and again same point. The course is only for last 1 to 2 months. So I want you not to waste in surgery videos time. I want you to read MCQs and go to the exam with that MCQ knowledge. Even Abhishek AP has done the same thing. He has gone and seen the previous NESS general surgery questions. Sorry. And read the same concepts again and again. See, understand that NESS general surgery questions will come in NESS head and neck exam also. But for that, do you need to cover entire book or you need to cover work in a smart way? You do hard work, that is for head and neck. Don't do the same hard work for general surgery. That is my point. I have seen 7 years exams of like 14 exams of NESS. I am telling a easy tip for general surgery. Do Q bank, follow one Q bank, go back, open the textbook, read that para and come back and answer. That is fair enough thing. Fair enough thing. And sometimes 2 to 3 general surgery questions may come. For that, I have already shared a just sorry statistics book will questions will come. For that, I have already shared a book in the group. If not, you have to buy it from Amazon. It costs only 150 rupees. That would be okay for you. Forest plot or some the box and whispers plot they will give. Sometimes like they will give like tests of significance. These are the common questions in NESS. They will just do juggle of 1 year this one year that one. So that way. So this is regarding NESS. Anything is there for NESS, please ask me. I'll tell you what to do. So generally in the otology, very rarely they ask doctor. Yes, but you have to read classifications. So classifications I already shared in the group. Syndromes and classifications in search test group. Please have a look. They will definitely ask. I told you like Benjamin Ignis classification, Bogerson classification, glomus tumor, fish staging type. This favorite question. What is C2? What is C3? The favorite questions involving so and so vertical portion, horizontal portion, they are favorite questions. So that's what I'm trying to tell you. You need not read whole ENT. No, definitely no. General ENT, otology not required. Otology, they will be asking you something related to temporal bone cancer. That is otology topic only. So vestibular schwannoma, that is otology topic only. So head and neck means again it includes a little bit of skull base. So some skull base cases come. So 1 year exam question is persistent stapler artery is associated with absent foramen spinosum. That is 1 year question. So will you place it in skull base or will you place it in otology? So that's why you should understand. Yes, confusing question like good performance status but cartilage eroded. So pharyngeal cancer, what will you do? Please mention again what books you have mentioned. So for NESS, there are no books, doctor. NESS, only Stellenmarn is there. For now, NESS I am dealing. So, for example, Arbaz Sheikh is mentioning like there is a confusing question like good performance status, but there is a cartilage erosion. What is the management in a hypopharyngeal cancer? So, you will do total laryngectomy since cartilage is eroded because you cannot cure a disease with chemoradiation. So, that type of clenching points they will ask you. Even in interview, the same thing will go. Even in interview, the same thing. Right. That's about NESS. So NESS, the only book is Maran to read. I think the PDF is not available anywhere. And so you need to see. You can get it in 5,000 rupees at the rate of Prudvi bookstore. Prudvi bookstore, which is available in Bangalore. Even I brought from it. So it is 20,000 in Amazon. Huge. So Stellenmark you can get at 5,000 rupees. Student discount, which was given by CRC Press directly, or you can contact CBS bookstore also for this, where you get Stellenmark book for 5,000 rupees. Only 5,000 rupees. Originally it is 25,000, but they are giving it a student discount price. So have a look of that. Prudvi Bookstore, Bangalore. You can type in the internet, it will come out. And you can contact his number also. Yes, Arbaz, you can go with total laryngopharyngectomy. Yes, you can do. That's not a wrong thing. No, we have included surgery MCQ package in NESS course. We have included surgery package, surgery MCQs in NESS course. You need not purchase anything. Just come and purchase rapid revision head and neck course. Okay, Manika? What to read from Stellenmark? So Arbaz, I am already dealing with majority of the things in the class. It's like a what to tell. You have to read the same thing twice in the book. It's difficult to cover the entire book. That's why I'm dealing with already everything from Stellenmark, ATA guidelines, recent trials, immunotherapy. I'm not even leaving any old question. I am covering everything in the class. Though it is written 8 hours, I am taking it to be 15 hours, not a worry, but I want to cover everything. So just log in onto Search Test app, purchase the course and enjoy. Okay. By 17, we are updating everything regarding ATA guidelines in the app. That is about INESS. Any more questions for INESS? Otherwise, we will discuss regarding NEET SS. So in ESS, yes, percentage questions will be asked. I have also dealt with that. RAS mutation, how much percent, BRAF mutation, how much percent, and different things they are asked. See, I told you already, just they don't want you to write and excel in the exam. That's the thing. They don't want you in the competition. You should think like I should be in the competition and write the exam. That is the trick for NESS. And NESS, yes, they have a lot of Q bank now. So this point comes once you clear the theory, I mean MCQs, and go to the interview. Your experience matters because they will give you 5 marks for 1 year of experience, 5 marks for every journal. So that happens when you clear the part one. Like if you're asking me like IAS exam, prelims, mains, then interview. So prelims किया तो तब आपको सोचना है experience ये सब. Prelims नहीं किया तब तो no point. So at least prelims if you do, then it would be better. And last year this Abhishek AP has not done any course, not done anything. Just is used to work with this professor in a ENT thing, ENT PG thing, but he used to have a little bit of exposure. So prevalence can be asked. Yes, this type of question, geriatric. So this is a direct line from against LMRN. I'm dealing with that in the class. Okay, direct line, direct question. So there is a Globocoin data from which they have taken this ARBAS, prevalence of oral cancer above 80 years in India. They asked this question last 10 years, I know. I'm dealing with that in the class. Any more things how to prepare for NESS? Or shall we move to NEET SS? So this is one-stop solution. So I don't want you to juggle again and again what to read, how to read. You will have ENT minimal questions, general surgery like 30 to 40 questions. You can expect 35 questions maximum. Head and neck, basic head and neck questions, basic head and neck, which sometimes on trials and immunotherapy and these percentages, these are common. And ENT questions like classifications, syndromes, and something like if they want to ask related to skull base, they will question you, right? Which approach is better for a schwannoma, which is less than 2 centimeter size? Middle clinical fossa, hearing preservation approach. So this type of questions come in the exam, which is clinical and case scenario. Now, so there are no important topics for NESS. There is no important topic. They will touch thyroid, they will touch parotid, they will touch oral cancer, they will touch oropharyngeal cancer, they will touch everything in head and neck. So 50 questions will be in head and neck. 5 to 6 questions would be in ENT. 34 questions with 1 or 2 skip will be from. Yes, robotic will have 2 questions because it's a head and neck part. Robotic has 2 questions. Yes. That's a head neck part. So 50 questions in head and neck, 5 questions at least, 6 questions at least from ENT. Next, 34 questions to 32 to 34 questions from general surgery. If your luck is okay, there is no statistics question. If your luck is not okay or they want to trouble you, they'll give 2 to 3 statistics questions. That's NESS have repeat topics. Yes. So the key for another key for NESS exam is repetition of the topic. That's why I told don't watch any general surgery videos, which would be a time waste, Since the topic will be repeated, go to the topic and read the topic. Without reading the topic, you will not get any answer. You will not get any concept. So general surgery reading is difficult. Keep Bailey and Love. Open the Q bank. Solve the MCQ. Go back there. I know when you see testicular tumor, we won't understand anything. But read the question. Try to understand what he wants there. Then go back and see the chapter once. Read the whole topic. It will take 15 minutes for you to read testicular answer because you will be hunting the answer. You know the question is there. You took it seriously. You will be hunting the answer. Along with that answer, you will be finding many other points which you will note down. So this is retrograde reading. Please do practice that for general surgery. Don't read foolishly sitting like hours and hours general surgery, because whatever you read, they will ask some new question. I got a question for pneumoperitoneum, what is the pressure? I got one more question regarding shock. Endocrine shock they gave me, circulatory endocrine shock. So try to understand, you cannot get the same topic, but you cannot get the same MCQ, but they will repeat the topics. Definitely you should understand, you when you take a Q bank, when you take a Q, open a Q bank, every question needs to be answered. Every topic is important, but you cannot finish the topic. That's why you're reading retrograde. Okay, right. That is regarding NESS.